Well, we're going to talk about the light therapy in the morning for some patients. Older patients, when they have a problem sleeping too late, for example, you sleep at 2 o'clock in the morning, wake up at 10 o'clock in the morning. This is called as a delayed sleep phase syndrome. So what we need to do for those patients, or even the teenagers who go to sleep late, they go to bed at 2 o'clock on the weekend, wake up at 12 noon or 2 o'clock in the afternoon. That means the circadian rhythm is delayed. So we need to bring it back early, like 10 o'clock or 9 o'clock to normal time. So when you get up in the morning, you need to come out. You can sit in the shade, don't have to be in the sun, because some people may not tolerate the sun. So you sit here, if you want a cup of coffee like this, it's fine, but you need to look at the sky towards the east where the sun rays are coming. Sun rays comes through the pupil in the eye and goes to the forehead, goes to the suprachiasmatic nucleus and changes the circadian rhythm. So biological clock is in the frontal cortex right here. So by having the sun rays coming through your pupils of the eye, it shifts the clock. That means it will shift from 11 o'clock to 9 o'clock or 8 o'clock like that. So any patient who has a delayed sleep phase syndrome, like sleeping late, waking up late, called delayed sleep phase syndrome, they have to get the light therapy in the morning. Like I said, for a patient who has depression, sunlight can be really a problem, can cause depression episode. That's why you can sit in the shade, but look at the sky, look at the light. That will help you to shift the clock. On the other hand, older people, for example, they are in 60s and 70s, they sleep at 9 o'clock and wake up at 2 o'clock in the morning. That's called as early sleep phase syndrome or advanced sleep phase syndrome. So the advanced sleep phase syndrome, what you need to do is do not get the sunlight in the morning, but do in the evening after 5 o'clock or 6 o'clock. Again, you can sit outside in the shade, but look at the sun on the west side. So sun rays comes to your eye, again comes to suprachiasmatic nucleus and changes the biological clock. So what happens in the evening when you are exposed to, if you're sleeping at 9 o'clock, your sleep rhythm goes forwards to the like 11 o'clock, 12 midnight, 1 o'clock, whatever. So if you want to shift it to sleep late, you have an exposure in the evening. If you want to sleep early, exposure in the morning. And also, you can take melatonin if your patient has a delayed sleep phase syndrome, like teenagers. You can take a melatonin 3 milligram tablet about 3 hours before the bedtime. On the other hand, in the older people, they can take the melatonin actually in the morning. So the summary is that the teenagers with delayed sleep phase syndrome, they need a light exposure in the morning, as when they get up within 30 minutes, and melatonin 3 milligram about 7 to 8 o'clock in the evening. Melatonin is a dark hormone, makes the brain to think that this is dark, it's a dark hormone. On the other hand, elderly patients who have problem with sleeping early, like 8, 9 o'clock, waking 2 o'clock in the morning, and they have to have the light exposure in the evening after 5 o'clock or 6 o'clock, and take the melatonin in the morning. And also, very important, coffee like this you should not be drinking after 2 o'clock. Morning 1 cup is fine, maybe maximum 1 cup at 1 or 2 o'clock in the afternoon, but after 2 there should be no coffee, no caffeine, no Coke, no iced tea. A lot of us have a habit of drinking iced tea with the dinner, especially in the evening. for relaxation. Do not have iced tea in the evening with the dinner. And also wine also a problem. Wine also keeps you awake. What happens, you can sleep early and you sleep for a few minutes and you wake up later part of the night, 2 to 6 o'clock in the morning, lots of fragmented sleep. So I don't recommend having any alcohol at night to sleep, because lots of patients, 40% of patients use alcohol many times to sleep. So alcohol is not a sleeping medication. If you have a sleep issue, see the sleep doctors and take the right advice, but don't drink because you want to sleep. So that's why the alcohol addiction comes in, because people want to sleep. So it causes a lot of fragmentation of the sleep, and also causes memory effect, and also causes permanent brain damage, which cannot be reversed. They have a lot of REM rebound, and later on they develop significant brain damage. That's why do not drink to sleep, and see the sleep doctors.
So basically, to summarize, Dr. Bhat, teenagers who sleep late at night, in order to shift their bedtime forward to an earlier bedtime, they should be exposed to sunlight in the morning. And older people who like to go to bed early, like 8 or 9 o'clock, they are sleepy, but their sleep is over by 2 in the morning, should have sun exposure in the evening. Having sun exposure in the evening is going to push back their bedtime, and they will go to bed a little later. In that way, they will wake up, they'll have a little longer sleep, and probably will wake up at 5 o'clock in the morning instead of waking up at 2 or 3 in the morning. Is that correct? And teenagers who go to bed at 2 or 3 o'clock in the morning and wake up at 2 in the afternoon or at noon should have sun exposure in the morning, so that their biological clock is set forward, in the sense that they will start feeling sleepy earlier and maybe will go to bed by 10:30, 11 or so. And
also, one more thing we need to discuss in this context. Many elderly patients, they go to sleep at 9 o'clock, wake up at 2, then they sit in the bed looking around, I can't go to sleep. Again, they go to bed at maybe 5 o'clock, they wake up at 7 or 8 o'clock. It's the most common problem. The problem with that is they go to bed too early at 8 or 9 o'clock. So what happens is you have, in the sleep biology, there are two different systems. Just like 2 lungs, 2 legs, 2 hands, 2 eyes, you have a 2 sleep system. One is the homeostatic system. Homeostatic means more you are awake, you develop a hormone called adenosine, and many other sleep hormones, GABA, adenosine, a bunch of sleep hormones. Longer you are awake, they build up. They peak around 10 or 11 o'clock at night, and then what happens? You sleep at 2 o'clock, it's gone. Then what happens is the circadian system has to pick up. Circadian system actually is a biological clock that picks up at 2:30, 3 o'clock in the morning. What happens between 2 to 3, you have a big gap to jump the sleep system to pass through. When you're young, what happens? You have a lot of growth hormone. The growth hormone bridges the gap. This over jumps to the circadian system. As you get older, you do not have that growth hormone. So obviously, you wake up 2 o'clock, and this hour and a half, you're awake. So what I recommend for those patients is to go to sleep late. Do not go to bed at 9. Go to bed at maybe 11:30, could be 12. So what happens? Homeostatic hormone is right here. Circadian clock is here. By sleeping late, you bring closer together, 2 hills to close together. You sleep here, homeostatic, suddenly you jump into circadian system, so you go through all night, you sleep. Otherwise, you have a gap, homeostatic here and circadian here, you've got a big gap. So go to bed at maybe maybe 12.
For the older patients.
Older people. 12 they go to bed, 12 midnight, wake up a fixed time. No clock in the bedroom. Don't look at the clock. If you have a clock, turn towards the wall. Set up an alarm in the morning. Whenever you want to sleep, like 6:30, 7 o'clock, set up. So do not look at the clock no matter what time you wake up. When you look at the clock, you're going to worry about, oh, I have an hour left, or 30 minutes left, or 2 hours left. So mind keeps on thinking about that, so they can again go to sleep. So what you do is set up a system at 6:30, your alarm clock, go to bed at 12, maybe 12:30, and then at least 5 hours, that's all you need. And during the daytime, no matter what happens, at 6:30, whether you sleep or not, you do not take a nap. Just wait until 12 midnight the next day. So don't take a nap. And even if you don't sleep at night, do not sleep during the daytime. If you sleep during the daytime, what happens? You will take your sleep away from at night. So what you need to do is 12 to 6:30, 12 to 6:30 for the 1 week. A week later, come to 11:45 to 6:30. 11:45, 6:30. A week later, 11:30. Week later, 11:15 to 6:30. 11:15 to 6:30. Then 11. Then 10:45, 10:30, whatever. So if you can go to bed within 20 to 30 minutes of when you go to bed, the sleep onset happens within 20 to 30 minutes. That's when it will stop going backwards. So what we're trying to do is give you some sleep restriction. So sleep deprivation for a few days. So you go to sleep right away. So the anxiety that you can't sleep is going to be diminished. So by 12 or 12:30, you go to bed, do the meditation like I showed you, then you sleep. Probably will go through until 6:30 with no problem. So if not, keep for a week, keep on trying it, you'll go to sleep. So then you know, you think you don't have enough sleep, come back. Again, like 12, 11:45, 11:30, 11:15. Stop somewhere in that range. They will help you to fix the circadian system and the homeostatic system in synchrony. Normally what happens is desynchronized. Homeostatic is here and this one is on this side, circadian. So we want to bridge the gap close together. There is a purpose of sleeping late for elderly people and bridge the gap. Also what we do in some patients, if you really have a problem, there is a drug called Sonata, Zalopon. You can take that pill like 2 o'clock, let's say you wake up, you can't go back to sleep. You can take one pill, comes in a 5 milligram, 10 milligram tablet. You can take that if you can go to sleep. That's fine.
So you basically take it when you wake up at 2 in the morning and not to go to sleep. So you don't take it at 9 o'clock, but you take it when you wake up in the middle of the night.
Because a lot of these patients may not have a problem for sleep onset. They sleep okay. In fact, they sleep too early. So the problem is at 2 o'clock to 4 o'clock you can go to sleep. So in that case you can take Sonata. As long as you have about 2 to 3 hours of sleep left, next day you'll be fine. Normally a lot of patients after 40 to 50 years of age have issue of waking up at 2 o'clock in the morning. This is very, very common, very predominant. And so what we try to do is bring the homeostatic system and the circadian system close together. If it don't work out, you can always take Sonata, maybe first few months and get used to it. Maybe you'll be able to stop the medication after a while. And the other thing, if a lot of anxiety, you have a racing thought, you worry about everything, and you're anxious, you're nervous, worry about your daughter, worry about your work, worry about everything, and that's because of anxiety and panic. In those patients, I recommend using maybe lorazepam, called Ativan, or Xanax, some other relaxation medication to help before you go to sleep, maybe 11:30, 11:45, take the tablet and wait for a few minutes, then you go to sleep. Of course, the meditation technique I showed you, relaxation technique with a breathing technique is going to be helpful, and just a 0.5 milligram of Ativan will help you to relax you, then go to sleep. Any questions?
No, that's it. So basically is just making sure that you do relax, don't watch TV in your bedroom, have good sleep hygiene, go to sleep at the same time, wake up at the same time. Even if you don't fall asleep, 20 or 30 minutes after retiring to bed, you recommend that the patient do something else out of their bedroom, Dr. Bhat, or
not
do they
go to the bedroom until they are sleepy. No activity in the bedroom, no computers, no iPad, no iPhones. So do not go to the bedroom until you're sleepy.
So only when you're sleepy, try to retire to bed.
And also,
and not to clock watch.
not to 20 minutes before go to the bedroom, in the living room, practice this meditation like I showed you, like meditation, and go back to the bedroom, lay down, through the mind, control your breathing like I showed you before. So that's important. Then you go to sleep. Any
Okay.
other questions, Sudha?
No, that's good. Thank you.
Sleep hygiene is important because exercise is extremely important for everybody. So exercise, morning, get up, get your bicycle, go on the bicycle. Good cardiovascular exercise is going to help you to sleep better. Always exercise in the morning if you want to sleep early. If you want to sleep late, like old people, like 60s and 70s, they sleep early, too early in the evening. You want to shift the clock more late and exercise in the evening. So getting up, running, exercising, or working on your muscles, relaxation, and good workout is important for a good sleep. A lot of studies have shown that the exercise is going to help you to increase the stage 3 and stage 4 sleep. You sit around at home on the couch, don't expect to have a good sleep. So this is one of the important sleep hygiene. Exercise, exercise, exercise. See how I'm going now? See, ride the bicycle. And that's it. Very important thing for you to know that the bedroom has to be totally free of all the electronics media. See the bedroom here? I have no TV and a nice bedroom, and you can see we don't have any computer room, and outside you can see the beautiful lake, and you see that, but you don't have any, there's no TV in the bedroom, just a simple walls and pictures, but there is no TV in the bedroom anywhere. So it's very important for you to realize that all the distractions in the bedroom can cause sleep issues. So it causes a lot of irritation. Nowadays the children with all the multimedia like iPhone, iPad, and all kinds of devices they're going to have. They play the game, the video, they watch the videos, watch the different games, they play the games, and all causes distractions. So bedroom has to be free from all the irritants, stimulants which cause the bedroom. So bedroom has to be free from any media devices, iPhone, iPad, and television as well. So don't use the bedroom as a workroom. Bedroom is only sleep and sex. A lot of people don't realize they make the bedroom as their workroom or playroom or watching the TV. And a lot of studies have shown now that recently that the children constantly on the iPad, iPhone, they get a text message off and on. They don't look at when to sleep. They keep on texting, and a lot of times their brain not in the full sleep mode. For example, as a doctor, if you're on call, somebody on the ventilator, what do? Your mind's always alert, waiting for the call from the hospital. So just like you're on a 24-hour call, you're alert. So brain is in the alert mode when you have all this media, and the kids gets all the text in the middle of the night. They're communicating in 1 or 2 o'clock in the morning. So the best thing is to, as far as I'm concerned, after 8 o'clock, all the media has to be out. iPhone, iPad, everything has to come to the living room and lock it up until the next day evening. So that is the best mode of therapy, because children won't listen to you. And also to give them 1 day in a week without any iPhone, iPad or any media. They have to live 1 day a week without any of these devices. They can play outside, they can run, they can jog, they bicycle, they can play the baseball and go for kayak, go for swimming, whatever they need to do. They should be able to spend a day without iPhone, iPad and televisions. So that is one mode of therapy you should use in these children who cannot sleep, because the media devices are causing a lots of problem with the children's sleep. When they go to sleep, they don't sleep. They're in the stage 1 and 2 sleep, no 3 and 4 stage sleep, because they're always alert. Then they get up late in the morning, they already are in a delayed cycle. They sleep late, wake up late. So first 2 hours in the classroom, they're sleepy. They can't learn anything. Until noon, they're not grasping anything in the school. That's why I'm saying that you got to get all these devices out, lock it up after 8 o'clock or 9 o'clock, whatever, and you should be able to sleep without any issue. So this is what I want you to, as parents, see what's going on. Don't say, hey, Jason, go to sleep, and same at 9 o'clock or 8 o'clock. But the kid never sleeps. He'll be doing all other things. So it's very important to monitor these children, get off the iPhone and iPad. Okay? Thank you. Okay, my name is Dr. Bhat. I am a sleep specialist, and today I want to talk to you about one of the sleep hygiene issues, that what we need to do. And a lot of times you cannot sleep at night because of they think the bedroom is irritant. When they go to bedroom, they think, I'm not going to sleep. When they think you're not going to sleep, you're not going to sleep. In fact, sometimes we recommend stay awake, try to stay awake rather than going to sleep. So one of the methods of relaxation, there are many. One of them that I like is meditation, because it is very simple, easy to do, don't take too much effort, and like I said before, exercise is very, very important. And what you do, for example, you want to go to sleep, let's say 11 o'clock. So I want you to come to the living room, sit down, relax, get all the other work to be done, like tomorrow's work, your iPhone, iPad, whatever, tomorrow's scheduling. Do all that before 9:30, 10 o'clock. So when you go to the bedroom, you never have to think about what I want tomorrow morning, what's my schedule, whom I want to meet. You got to stop thinking all of that, because that causes brain stimulation, which causes not to sleep. So finish all that, come to the living room like we have here, calm, quietly, and what you want to do is put your finger on the forehead. See, look at here, and I'm closing on this side with the thumb. So breathe like this. Close your eyes. Inspiration, expiration. Inspiration, expirations. Okay, now I'm going to teach you about the meditation, which is a relaxation technique. First I want to show you so you can see it, then I will show you how you should do it at home. For example, here you close this nostril and
so you're basically closing one nostril, inhaling through one, exhaling through the other, then inhaling through that one and exhaling through the other.
Inhale, exhale,
Inhale, exhale. Inhale, exhale. Inhale, exhale.
Now I will show you how you do it normally, like this, in a meditation method. Put your finger on here, like this. Okay, do this for about 10 to 15 minutes. It has to be slow, normal breathing. You feel the volume, the flow, and the warmth of the breath. So concentrate basically on what you do after you go to the bedroom. You don't have to hold the fingers. Lay down nicely in the bedroom, on the bed. Through the mind, you inhale, exhale, inhale, exhale, inhale, exhale, like this. Close your eyes, then so this will let you go to sleep slowly and you are in a meditative effect and then you go to sleep. Now I'll show you in the bedroom when you wake up in the morning 2 o'clock what you need to do. Yes, before you go to bed, after the living room you come to the bedroom, or even if you wake up in the middle of the night, you come to the bedroom, lay down first in this position, and I showed you the meditation. You need to follow that. So close your mind, breathe through the inspiration, expiration, inspiration, expiration, inspiration, expiration. So through the mind, you control the left inspiration, right exhalation, right inhalation, left exhalation. So also feel the warmth, the airflow, and the volume. So like this. breathe normally. Don't take too deep breath. Just breathe like you normally do, like this. So this will make you relax and slowly go to sleep. 2 o'clock when you get up in the morning, just go to the bathroom and come back. Again lay flat in this position and slowly meditate, and you will drift back to sleep. It's a simple solution for in some patients. It will not work on everybody, but this is the easiest way to try it out and see how it's going to work out.